Okay, Hariom everyone. Now we'll go for last gynecological disorders. My screen and audio is completely audible to all and visible.
Yes.
Yes, ma'am.
Okay. So last part of it will cover now menopause. This we did it last time. Menopause we've completed or not? In last class, what we have studied dysmenorrhea. Okay. So now today we'll go for menopause. As we seen before also, what is menopause? What is menarche? Who will tell?
Menarche is the when the menstrual cycle is starting. At that point, it's called menarche.
Okay. So now menopause, with the name itself, we can understand that something meno means related to menstrual cycle and pause means a stoppage. Okay. So something which is related to stoppage of the menstrual cycle. Menopause is a stage in life. So we can say when you stop having your menstrual cycles or periods. Okay. So this stoppage of the time is called as menopause, this situation. It's normal part of the aging and marks the end of your reproductive years. That means now no more you will be able to conceive. Okay. So it typically occurs in your late 40s and early 50s. Usually it is said that in age of 45 it is last. In age of 45 it is last that usually female used to have due to nowadays sedentary lifestyle and no proper eating. Females are having like early menopausal symptoms also, that they are getting menopause in early itself. So usually, but the range of the age set is 40 to 50s. After 50, they like maximum age is 50. As menopause nears, the ovaries make less of the hormones called estrogen. What is the work of estrogen? You all have studied in anatomy. Who will tell? Can anyone tell the work of estrogen?
Ma'am, estrogen and progesterone, these two hormones related to the or means we can say reproductive system.
Secondary sexual characteristics, ma'am.
What is the functions of estrogen? I'm asking you.
Relating to egg production, ma'am.
Yes, for the proper, actually, this is called as growth hormone also. This is helpful in the proper development of your ovarian eggs. Okay, for proper growth of the ovarian eggs, this estrogen is produced. Is the estrogen is only produced in females or also in the males?
Only for
Only
females.
in
Only for female, ma'am.
No, actually, in ovaries releases estrogen, and females also testes releases estrogen. Okay, so they have different functions that you can see afterward.
Sorry, ma'am, can you repeat this again? Is it, it's only for females, right?
No, actually, in the males also testes release estrogen because these two hormones. Because all you all know, na, females also have the male characteristics as well as female characteristics, and males also have female and male characteristics. They are defined on the basis of the dominant characteristics. Therefore, it is visible like that.
Then that means females also produce this progesterone hormone.
Yes, yes, yes. You didn't learn that menstrual cycle in anatomy. You have studied that
No,
whole
ma'am, I
chart.
didn't know that's the subject till now.
Ma'am,
Ma'am,
now we start.
progesterone is essential, ma'am. Testosterone, I think, should not be there more in women.
But in females also testosterone is there. Usually what happens at the
Yeah,
time of the
yeah.
PCOD and all diseases like this, females are having more testosterone hormone. That's why they are having more hairs on their faces like males. But not exactly like males, but as this is the main symptom of the males, so usually females also have lots of hairs on their faces like that. They have the whole body. So at that time they have a little amount of more testosterone hormone. You can't say that only males have this hormone. All have, but predominancy is the one which is visible to us. Okay. So For women undergoing natural menopause, the process is gradually and is described in the three stages. Okay, so for the women who having the normal or natural menopausal without any problematic situation or any of the hindrances or any of the specific medical disease, the process gradually it describes in the three stages. That is perimenopause, menopause, and postmenopause. With the name itself, we can understand something which is related to peri. Peri means something which is related to before, a little before. Menopause, exactly when the stoppage of menstrual cycle happens, and postmenopause after the like after stage of your menopause. Okay, so usual symptoms in menopausal symptoms, we can say what happens. You can even identify these symptoms in if you have your mothers are at that age or someone in your family also. Okay, they used to have this. So irregular periods may happen that the man they are not getting menstrual cycle every month. Maybe they are having alternate month they are having that these symptoms. Maybe it could happen that they have their menstrual cycle within three months. Like that irregularity in the monthly period cycle they could have. So therefore it is one of the symptom, that is irregular periods. Vaginal dryness could be happen, uh, and hot flashes, chills. What is chills? Who will tell?
Ma'am, chill is a mechanism where body produces heat to tamper the like body like yeah tamper the heat when we are having uh, cold.
Rapid muscle contraction and relaxation, ma'am.
To maintain to
Ma'am,
main,
rapid muscle contraction and relaxation, ma'am.
that is okay, but to maintain the
He,
homeostasis of the body, I have.
he, body temperature, man.
Yes. So this maintenance of the body temperature of the body is called as homeostasis. Okay, homeostasis is nothing but the management of this thing. Okay, anything we can say that this is to maintain the homeostasis. So the here it is a temperature homeostasis. So this, and here this hot flashes. Can anyone tell what is hot flashes? A little feeling
Start
of warmth.
sweating suddenly, ma'am.
Yes, a feel too much feel like sweating type of, or feeling too much warm or like that. Okay. Now night sweat, sleep problem, this could happen at that particular age of the female. So we can say that it is premenopausal symptoms. Okay. Mood exchanges will happen. Weight gain, either too much gain of the weight, or they can even have too much lean also. Okay. When weight gain is there, of course I told you in the obesity also, slow metabolism they have, decreasing fertility. Okay, of course after the menopause they will, this is the stage coming that they are losing their property of fertilization. Okay, loss of bone, that means degeneration of bone. Okay, changing cholesterol level, perimenopausal symptoms, we can say that. Okay, so these all could be there, not so important, still you should know. Perimenopausal or postmenopausal, we'll see perimenopausal. It can begin 8 to 10 years before the menopause, exact menopause. This we are saying perimenopause. Okay. It can begin 8 to 10 years before menopause when the ovaries gradually produces less estrogen. Okay. Not that complete estrogen production will not be stopped, because complete stoppage of the estrogen production is called as menopause, because completely there is no production of estrogen, so no growth hormone for the egg follicle to get developed. Okay, so this is the stage 8 to 10 years before menopause. Now it lasts up till until menopause, the point when the ovaries stop releasing the eggs. Okay, so what happens, since starting there will be the less release of the estrogen. Okay, further it will end up till the complete, when estrogen is completely stop releasing. Okay, or the ovaries will stop releasing the egg, the at exact time. Of course that is peri. So it lasts for around 4 years, continues till the ovaries stop releasing the eggs. This same thing we have studied. This is very small topic today, and we'll complete. Now symptoms, hot again, peri also, this is perimenopausal symptoms. Hot flushes, breast tenderness, they could have fatigue or too much dizziness also they can have, because sometimes happen that females get fainting and all due to weakness and all. These all are the hormonal disbalance or hormonal changes taking inside them. Irregular periods, urinary incontinency could happen, mood swings, trouble sleeping, etc. Okay, as in sleeping they're getting too much like too much warmth and are feeling disturbed sleeps. Now, postmenopausal, before only with the name itself, we can understand very simple. The after stage of menopause. This is the name given to the period of the time after a woman has not bled for an entire year. How we'll say, if we are saying that in a perimenopausal symptoms, what happens if this is the one first month, female is having first month means January. Female is having their normal menstrual cycle. February, March, April, May, June. Maybe get gap. Then she's getting again this menstrual cycle. Okay, no problem. Then on third month, next again there she's getting menopausal symptoms. After 5 months again. So how we'll say that now it is completely gone off? So we'll analyze and we'll see and just observe that if until for like last period cycle they are having, after that for 1 year if regularly she is not getting menstrual cycle, it means that this is the actual stage of postmenopausal symptoms, or this could be the postmenopause. Okay, so usually you
Ma'am,
know. Yes,
am I audible properly?
yes, ma'am.
Yeah. I just want to ask, it is not from syllabus. When this menopause happens to a woman, and then she want to like do the in vitro fertilization, that is it possible to do that?
No, I don't think so, because they don't have the healthy cells now, like healthy eggs.
No, 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 I'm not saying that. Like suppose her not her egg from some other woman's.
Where an egg is combined to the, okay, so the egg from the another woman they will take, and their whole embryo development will happen in the female itself. This you are saying, na?
Yeah.
No, it could not
In
happen
vitro
because
fertilization, what did the egg? Yeah. Okay. Yeah.
actually your voice is a little disturbed. Can you repeat the question? My voice is audible.
Am I audible again properly, ma'am?
Yes.
Okay. Sorry, I have network issue today. I came outside of my house. Okay. So I'm asking, ma'am, ki in vitro fertilization, the fertilization of egg and sperm done outside of the body, right? And then they put it into the women's what we say uterus.
Yeah, uterus.
Yeah. So is it
So
possible that yeah.
no, it is not possible. If the menopausal for the menopausal female, you there is no like development of all that blood and all, because there is no this menstrual cycle is happening. So what happens when the egg is released? Actually, what happens when the egg is released from the ovaries? For that, like every time our body will think that sperm will come and that like indulge with it, but this doesn't happen. So for that, because our body thinks that maybe there will be fertilization will happen, so whole preparation for it, the whole month our body does the whole preparation for it. So every time in the uterus carries all that cushiony structure like blood, in which the embryo is implanted. So if that will not happen, because egg is not releasing, if egg will not release from the ovaries of the female, why this whole preparation will happen? If this whole preparation will not happen, so what happens when the whole preparation happens, but after the 14th day, when our body sees that there is no sperm to get indulged with the egg. So exactly at that time, this whole shedding of this blood happens, and which we call as menstrual cycle. But in this menopausal female, as egg is not releasing, so no preparation of all this blood and this cushiony structure for the embryo implantment will not happen. Okay, so uh, female can't implant the baby inside because no preparation for him is there. Understand?
Okay. Yes, ma'am. Yes, ma'am.
You
Thank
this
you.
is not possible, but I explained you so that you can completely get satisfied. Okay,
Yes, ma'am. Thank you.
now it is clear. Okay,
Yeah.
so now we'll go for yogic management. So usual normal yogic management is there. We have seen before only in last class with dysmenorrhea. That will be the yogic management for this also, but something a little short, because this only this part only we can add it to is like in shatkarm jalneti, or we can add, and in asanas tadasan, or all those asanas also which we have studied in before yogic management. Okay, and along with that, Veerbhadrasan, Marjaryasan, that is cat pose. We used to relax the back, because usually what happens, as I'm saying that bone loss in before slides, I have told bone loss. This means there is degeneration in the bones of the females. Therefore, usually you can see at the time of the menopausal symptoms, females used to have like most commonly which we see, they used to have knee pain, they used to have back pain, and all these symptoms because degeneration of the bones happens. Females used to go for the lots of the loss of blood at the time of the pregnancy also. So all this could happen. Marjorie asan also for the back relaxation, and then Paschimottanasana again. Pranayam, we can go for Nadi Shuddhi, Brahmari, all others also. Okay, before I have told relaxation technique, Ajapa, Yog Nidra, all these meditative techniques we can go for, and along with that, before we have seen. Last part of this gynecological disorders in our syllabus is antenatal care. You or any one of you have studied about antenatal care before,
Is
or
it
you have
like, ma'am,
heard?
care before uh, pregnancy?
Are you sure or asking?
Ma'am,
Prenatal, ma'am. What is
actually,
prenatal?
my some of my relatives used to say that she's taking, she was going somewhere and taking some like massage and all. So
Okay, yes,
yeah.
yes. Okay. So we'll see here. Antenatal care. And this natal word is again for, can anyone tell? For
Something
child.
related to pregnancy.
हाँ मतलब something related to pregnancy or developing child. Okay, antenatal care is a care you get from health professionals during your pregnancy. So as you told that someone in your relative is going to someone taking massage, that means they get help from the health professional. They get the what is the exact right proper things they have to do. Okay, so this care or their advisement they give for the pregnant women, it's sometimes called as pregnancy care or maternity care. We used to understand what is the maternity word used for the female. Okay, pregnant female. Okay, you will be offered appointments with the doctor who specializes in the pregnancy and birth. The doctors which are specially or gynecological, you can in one word say that gynecological doctors or gynecologist you can go for, and can take the proper tips and advisement for the proper development of your uh, embryo. Okay, so these are the appointments taken by the specialist. This is very simple. So at last, therefore, I have kept this. This care typically begins because this is in your syllabus, so that to like for awareness maybe. So this care typically begins early in the pregnancy and continues until the baby is born. As it is care before the baby or health tips before the baby, therefore, of course, it will be end after the birth of the baby. Now, antenatal care, ANC, we used to call it. What happens is care provided during the pregnancy by skilled healthcare professionals to ensure best health condition for the both mother as well as the baby. So what in single word antenatal care is during pregnancy health tips by the healthcare professionals. Now intrapartum care, what is intrapartum care? Care provided during childbirth. Sorry, this is typing mistake, I think. One second. Uh, during the child birth, this is separate by skilled healthcare professionals to ensure best health conditions for both mother as well as baby. These all are the same things, but um, some have to which is related to our antenatal care only. Postnatal care, care provided up to 6 weeks. My like screen is now visible now.
Yes,
Yes,
ma'am.
ma'am.
Okay. Okay. So care provided by up to 6 weeks following childbirth by skilled healthcare professionals to ensure the best health best health conditions for both mother as well as the baby. Okay. Same thing. This is after. This is after. This is at the time, and this is before. Okay. This all is done.
Ma'am, in
Yes.
antenatal care, it is written during pregnancy. So by
But
this,
this is before. Hmm.
what
Mm.
is
This is before only, okay? I have seen
okay?
that, therefore I just repeated that word. That this is before, this is during. Only single word you have to learn, and this heading, okay? Antenatal during, before pregnancy, the healthcare professionals we have taken the tips for us, and intrapartum during the pregnancy, and post with the name itself you can learn. No need to learn up to 6 weeks, okay? So with this, we have completed our gynecological disorders along with their managements. Now we'll go for next system. How many systems yet now we have completed? Can anyone tell?
Four.
Okay, someone else can name them.
Respiratory, cardiovascular, this gynecologist, and one more.
Four, ma'am.
Okay, so we have completed with uh, respiratory disorders.
Yes.
Yes, ma'am.
Okay, so Sakshi ma'am will tell what is bronchial asthma.
Sorry, ma'am. Can you repeat?
What is bronchial asthma?
Yeah, ma'am. Bronchial asthma is the like problem which is occurring like आ रही है और हर बार हो रही है recurrent. Yeah, inhalation and exhalation में problem. Here airways get uh, smaller and swollen by excess mucus. So in this bronchial asthma, like three things happen: bronchospasm, inflammation, and mucus production. So bronchospasm is spasm in the airways, and in inflammation the airways get swollen, and in mucus production this body produce more mucus.
Okay,
So that, yeah.
very good. Now Lipalika ma'am will tell what is angina pectoris. Can you hear me?
Yes, ma'am. I am here. I can hear you.
So,
Angina pectoris. Ma'am, I
mm,
forgot. I revised but forgot how it is.
angina pectoris, very simple.
Yeah,
No,
yeah.
she will answer only.
Ma'am, can you hint me? Can you give any hint?
This is nothing but a term which is used for very simple. We usually in day-to-day life uses this.
Can
Pain,
you give?
something related to pain. Can you tell
Yes,
me that which
yes,
system it
yes, yes.
belongs to? Which system it
Cardiovascular. Yes, ma'am, I got it. This is cardiovascular related problem. Means when a completely, not completely, stop up the stop flow of the blood into the heart.
Okay. So who will tell that what is the whole series? No, before angina pectoris, just before angina pectoris, what happens? The term. Shravani ma'am will tell.
Is ischemia, ma'am?
Okay, what is ischemia? Can you tell?
Um, it is like an imbalance between myocardial supply and what is needed to the heart.
What is the actual need of the heart? Very good. And what happens just before the ischemia? Rajeshwari ma'am.
Um, Before the ischemia, ma'am, is it atherosclerosis you're asking?
Yeah, you are asking or you are
I'm asking,
asking or you
ma'am.
are telling? Oh, this is the nice way. Okay.
I studied, ma'am, but I'm not sure.
When you have studied yesterday, I told you
um,
na that I can ask question from first system also. Okay, we are about to complete our syllabus.
Ma'am,
yeah.
actually we need more times
CAD,
revision.
ma'am? Is it
Yeah,
CAD
after two,
before
3 days,
ischemia?
we are getting forget.
What ma'am, Lipalika ma'am? What are you telling?
Yes, ma'am. Ma'am, I did revision 3, 4 times, but after the 2, 3, 4 days means gap is there. If gap is there, then again I will forget. I am getting means I am forgetting. That's
Gap.
why
Gap
problem.
is given. Gap is given to revise itself, na.
Yes, ma'am.
Okay,
Use it.
Sakshi ma'am, tell what is the like sorry Shravani ma'am, tell what is the problem just before ischemia?
Ma'am, is it
Heart
coronary artery blockage, ma'am? Am
disease.
I right?
Okay,
Artery
Sakshi ma'am,
disease.
what you will tell? Sakshi.
Ma'am, me?
Yes.
Ma'am, what the process before ischemia?
Yes.
Okay. First, arteriosclerosis. It is basically accumulation of fat or plaques in the arteries
Well,
because of
just stop. What is plaque, Lipalika ma'am?
Ma'am, plaque is the fatty means fat. Yes, excess fat deposited.
In head, hands, legs, ground,
No, ma'am.
head,
No, ma'am. Excess fat deposited in the blood path
in
in the heart,
corner of
ma'am.
room.
In the heart means coronary pathway, we can say, ma'am.
Okay. So, how many types of obesity we have seen, Rajeshwari ma'am?
I think, ma'am, that
Think.
Android. Ma'am, please. I'm getting confused. Android, then gynoid, and then mixed, ma'am.
Are you sure?
Um, Otherwise, I remember, ma'am, when you ask like questions, whatever I know, I'm getting jumbled and getting
Oh,
confused.
I am a ghost.
No, ma'am, the exam kind of a thing itself causes panic.
Shravani ma'am, how many types of obesity we have seen?
Three only, ma'am. Android, gynoid, and mixed.
Oh, okay, you are saying so. Then okay. Okay, Rajeshwari ma'am, very good. Hmm.
Thank you, ma'am.
Okay, now Sakshi ma'am will tell um, how many types of, how many sinuses are there? Only in numbers.
Okay, so four.
Okay, can you name Lipalika ma'am?
Yes, ma'am. Ethmoid, sphenoid, maxillary, and another one.
No, no, no. You have only three sets.
No, no, four, four.
You have four.
ethmoid, sphenoid, maxillary, and another one.
Another one.
Not remembering.
Not. You don't have? You have or not?
Yes, obviously,
Where
ma'am.
you have that? Last one, where it is in your body? You have? So
Ma'am,
you should.
I can locate in the region means above the eyebrows, between the eyebrows, and under
So
the
that
eye.
what exactly that bone known as? That bone, that area, the bone is there, na? What it is known as? In
Yes.
anatomy you have studied.
Okay. So, ma'am started, but not remembering. Okay, sorry, ma'am. Sorry.
Frontal.
Yes, yes, frontal.
What? Yes, yes. No, no, you don't have frontal sinuses.
Okay.
Shravani ma'am, which bone is called as butterfly?
Spinoid.
Rajeshwari ma'am, open your mic.
Yes, ma'am.
Which gland is called as similar to that of butterfly?
Thyroid gland, ma'am.
Okay, what are the functions of thyroid gland? Rajeshwari ma'am.
Functions of thyroid gland, ma'am. It releases two hormones, T3 and T4. Triiodothyroxine something and tetra, ma'am.
Okay, something. Okay,
Sorry, ma'am.
something. Okay. So, how many types of allergic rhinitis we have studied, Shravani ma'am? Types.
Allergic rhinitis, ma'am. Only one, I think.
Huh? Didn't studied?
I think allergic rhinitis is only one, right?
Only one. Allergic rhinitis is only one in whole world.
Oh, you are asking seasonal those, ma'am?
No,
Types. Sorry, sorry. Yes, yes.
no.
Uh, yeah, I think four, ma'am. Seasonal and occupational and intermediary and
Intermediary,
something intermittent. Sorry, intermittent.
rhyming.
I think something
Eh,
other one part time. Huh?
Okay, who will tell what is dysmenorrhea? Okay, Rajeshwari ma'am will tell.
I think it is
I think
excessive,
everything you are thinking
yes,
only.
ma'am. Excessive bleeding, ma'am.
Excessive bleeding?
Excessive bleeding,
My
uncontrollable
God.
excessive bleeding.
I'm Lipalika ma'am, what is dysmenorrhea?
Ma'am, dysmenorrhea is the disease means we are getting pain before the menstrual cycle begin means the not only menarche means at the continuing
Means
time.
what you means? I can't understand.
Okay, means we are getting more pain before the periods, and we are getting means more bleeding. That's also means.
You are saying lots of means and not giving the means.
Sorry, ma'am.
In in single word, you can say this is painful menstrual cycle. Okay.
Yes, painful
And
menstrual.
you are saying means and ma'am getting means and before means and after means. Okay, Shravani ma'am will tell what is perimenopause.
Is the menopause before will happen? Before menopause.
Okay. Okay. So that Rajeshwari ma'am will tell what is the other name of gynoid obesity.
Gynoid is a pear, ma'am. Pear,
Gynoid, I
pear.
repeated. You have to give only the name of other name.
First one is apple, second is pear.
Second, what is second? Matlab,
PA, the gynoid ma'am, pear shape रहता है, pear shape, pear, PEAR,
This
pear.
usually
Third
happens
one is
in.
barrel, barrel ma'am.
Oh, okay, what is the barrel one is called as?
Mixed ma'am, mixed. पूरा
Okay,
ऊपर से नीचे तक मोटा मोटा रहता है.
मोटा मोटा रहता है. Okay, तो ठीक है. Okay, then thank you so much to everyone. Hari Om Namaste. Just revise everything what we have studied since allergic rhinitis till perimenopausal antenatal care. We have completed with gynecological disorders today. Now from tomorrow we'll start with other system. Okay. Sakshi ma'am, you left. No problem. We are just
No,
closing
no,
off.
no, I'm back.
Okay.